Good evening, everyone. My name is Juliet Glass, and today I will be doing a presentation on Colorado Springs Perinatal Mood Disorder Clinic. Pregnancy is often thought of as a happy time in a woman's life. Whether intended or unintended, pregnancy can be difficult due to the emotional, physical, social, hormonal, and transitional changes a woman must endure. Our society is becoming increasingly aware of perinatal mood disorders, but according to the CDC, it remains the most common undiagnosed complication of pregnancy. Perinatal mood disorder is the distressing feelings that occur during pregnancy, the perinatal period, and throughout the first year after pregnancy, the postpartum period. There are 4 types of perinatal mood disorders: perinatal or postpartum mood disorder, perinatal or postpartum anxiety disorder, perinatal or postpartum psychosis, and perinatal or postpartum obsessive compulsive disorder. Research has shown that perinatal mood disorders can be detrimental to maternal, child, and society outcomes. A mother's psychological changes can affect maternal-infant bonding, and this can lead to attachment disorders and greatly affect an infant's emotional well-being and feelings of security. These infants are at increased risk for developing anxiety and depression in childhood, teenage years, and as adults. And the societal cost of perinatal mood disorder is approximately $14.2 billion a year. My business was created out of a vision for my love of obstetric nursing and my role now as a psychiatric mental health nurse practitioner. I developed a clinic and a business plan because I saw countless women over the years who came in to our OB emergency room or to deliver who were off their medication. They had stopped their antidepressants, their anxiolytics, their mood stabilizing medication, and I've spoken to the OBGYNs who say, I don't know exactly what med to put my patient on, and I don't know where to refer them to. When I started to create and think about what I wanted my clinic to look like, I used Russworm and Larrabee's model for evidence-based practice change to help me analyze what exists and what is needed. The model has 6 steps. The very first is to assess the need for change in practice by comparing internal data with external data. Perinatal mood disorder is the most common obstetric complication that is undiagnosed in America. 20% of women are not screened for perinatal mood disorder. 50% of women who are diagnosed do not receive treatment. We've already talked about the long-term implications for mother, child, and society. And then there is a lack of standardized screening tools and policies in OBGYN offices. The second step in the model is to link the problem with interventions and outcomes. So I decided to implement a standardized screening tool and to create and implement a policy to ensure that every woman is screened. And then to do something different, provide psychiatric treatment services within the same location OBGYN care is received. The third step in the practice change model is to synthesize the best evidence, and I'm going to use a validated screening tool, the Edinburgh Postnatal Depression Screening Tool. And I'm going to use this because it's a valid tool that tests for depression, anxiety, and suicidality. It is used in 23 countries and it has been validated. The fourth step is to design a change in practice. Most women are screened at their initial visit, but in my clinic, the women are going to be screened at the initial, at 20 weeks, 28 weeks, and their 36-week visit. If they score higher than 6 on any of these visits, they're going to have a repeated screening at their next visit. If they score higher than 14, they are going to be internally referred for psychiatric treatment. If they are diagnosed during pregnancy, they can continue to see our psychiatric providers for up to 1 year. I would accept postpartum and pregnant patients from other OBGYN practices for psychiatric care, and all of our providers will have perinatal mood disorder certification. The fifth step in the model is to implement and evaluate the change in practice, including processes and outcomes. Our goal is to make sure 97% or higher of all our patients are screened according to the policy, and that 97% or higher of all diagnosed patients are offered treatment. The sixth step is to integrate and maintain the change in practice. So we're going to do a biannual review of policy and the community needs, and then we're going to do a quarterly clinic bonus for meeting both goals. And now I proudly present to you the concept of Colorado Springs' first perinatal mood disorder clinic. We all know that mental health nursing is always guided by Gene Watson's theory of caring. Humans cannot be treated as objects, and humans cannot be separated from self, other, nature, and the larger workforce. The theory is focused on the centrality of human caring and on the caring to caring transpersonal relationship and its healing potential for both the one who is caring and for the one who is being cared for. The values of my clinic will be based on Watson's 10 Caritas processes. The first is embrace, which is sustaining humanistic, altruistic values by practice of loving kindness. The second is inspire, by being authentically present, enabling faith, hope, and the belief system. Number 3 is trust, being sensitive to self and others. Number 4 is nurturing, developing and sustaining loving, trusting, caring relationships. Number 5 is forgive, allowing for expression of positive and negative feelings. Number 6 is deepen, creatively problem-solving, solution-seeking through the caring process. Number 7 is balance, engaging in transpersonal teaching and learning within the context of the caring relationship. Number 8 is to co-create, which is creating a healing environment at all levels. Number 9 is to minister, reverentially assisting with basic needs as a sacred act. And number 10 is opening to spiritual mystery and knowns, allowing for miracles. Colorado Springs Perinatal Mood Disorder Clinic will be Colorado Springs' first combined OBGYN and psychiatric clinic. Our goal is to identify, treat, and decrease the lifetime implications associated with perinatal mood disorders. The perfect location for this clinic would be right off Briargate Boulevard and acquiring a 5,500 square feet office space. This location is perfect because there's 3 hospitals in the area, and then there is also a large nurse practitioner-owned birthing center. This clinic will serve teenager and women who are conceiving or pregnant and up to the first year of postpartum. The services we will provide is obstetrical care, gynecological care, psychotropic medication management, counseling, therapy, and referral to community resources. Our practice will offer telehealth services for psychiatric evaluation and counseling. We will collaborate with other OBGYN practices to provide psychiatric care to their patients. We will collaborate with other psychiatric practices in the community. We want to collaborate with community resources. We offer a self-pay option. Our physicians and clinicians will be required to donate a certain amount of pro bono hours per year, and then we would like to do some work in the community as well. A competitive market analysis was conducted to compare our clinic to what is already being done in the community. These are the statistics for El Paso County, Colorado. In 2020, the population was approximately 737,867,000 people. 49.2% are females. 194,728 of the women are of childbearing age. There's an estimated fertility rate of 60.8 per 1,000 women, and El Paso County had 9,180 live births. The next 2 tables shows the results of the competitive market analysis. There were four clinics that our clinic was compared to. The very first one is the Promise Perinatal Mood Disorder Clinic in Denver. Then there's the Healthy Expectations Perinatal Mental Health Program in Denver. There's Strive Community Health Center in Denver, and then there's Peak Vista Community Health Center here in Colorado Springs. We compared the clients that they see to the clients that we're seeing, as well as the services that are being offered. This table shows the comparison with staffing, marketing, and payment of services between all five clinics. Next, let's look at the organizational plan of the clinic. The clinic will be an LLP, and it will have 5 co-owners, 3 board-certified OBGYNs, 1 board-certified psychiatrist, and 1 board-certified psychiatric mental health nurse practitioner. The business will be staffed by a business manager, an accountant, a psychiatrist, an OBGYN, a women's health care nurse practitioner, 2 psychiatric mental health nurse practitioners, 3 licensed therapists, a scheduler and a receptionist, 2 medical assistants, and a business attorney. Now let's discuss the financial plan. Initial funding will be provided by the owners, some private investors, business loans, and grants. The startup costs of the business will be approximately $2,100,000. This money will be used for acquiring business space, for the build out and design of the space, to obtain furniture, equipment, for the hiring of staff, for using for credentialing and liability insurance, for the design and implementation of the EHR system, for retaining an attorney and business development staff, to provide the first year's salary, 401k, and health insurance for employees. The money will also help to pay for contracted services, such as Medallion, which will provide licensing, credentialing, and payer enrollment service. Medicare MSO will provide the medical billing services. Epic Systems Corporation will provide the design, install, and maintenance of the EHR and prescribing systems. The next few slides will show how the cost for running the company has been calculated. This very first slide shows the positions of the employees and their annual salary and what the company will need to pay out for annual salary for all employees. This slide shows the fee schedule for the services that are being offered by the clinic. This slide shows the estimated daily revenue the clinic is expected to make. It is broken down by provider and the type of services they offer. The length of the visit the provider is expected to take with the patient has been lengthened in comparison to other clinics, and this is so that we can provide good quality care to our patients. The provider will be required to provide 7 hours of contact time with patients per day. And then based on that information, the expected daily revenue has been calculated. This slide is an estimate of the annual expenditures the company can expect. This includes the cost for leasing the building, the cost for an EHR system, the cost of credentialing providers, utilities costs, cleaning costs, marketing supplies, office supplies, providing insurance for our providers, providing insurance for the building, contributing 3% to our employees' 401k plans, and being able to help our employees by paying insurance payments for them. This slide shows our expected annual profit. The annual salary costs and yearly costs or incidentals were combined to give us the startup cost of the company. But this slide includes also a 5% loss and then training for our professionals to give an estimated expected annual profit for the company. Now let's discuss the marketing plan. We are going to target women who are trying to conceive, women who are currently pregnant, and women who are in their postpartum period. And our main marketing focus is that we are the only clinic in Colorado Springs that offer OBGYN services and psychiatric care in the same location. Furthermore, our psychiatric providers are all certified in treating perinatal mood disorders. The clinic plans to hire a professional marketing firm to create and disseminate print material, TV commercial, social media and internet advertisement, and to create billboards for the company. We are going to create marketing materials for OBGYN providers because we want them to know what our services are, and we want to collaborate with them and provide psychiatric care for their patients. We're going to provide marketing materials for patients. We're going to create specialized marketing materials for labor and delivery units in the hospital. Only 67.1% of live births in Colorado were born to women who had obtained adequate prenatal care. There are plenty of women who come into the OB emergency rooms, and that's when they receive their spotty care throughout their pregnancy. These units will be able to provide these women with information about our practice. And then we want to create specialized marketing material for the birth centers that are owned by certified nurse midwives. Now let's look at the future planning for Colorado Springs Perinatal Mood Disorder Clinic. My future wishes for my clinic will be to provide lactation consulting and a lactation support group, marriage therapy, family therapy, substance use disorder treatment, and then to open a new office in Southern Colorado Springs and a new office in Pueblo. In summary, while pregnancy is considered a happy time, it can in fact be one of the hardest times psychologically for a woman. The detrimental effects of untreated perinatal mood disorder can span a lifetime for that woman and child. Colorado Springs Perinatal Mood Disorder Clinic is a one-of-a-kind clinic to provide holistic care during this time of women's lives. Uniquely, we offer OBGYN and psychiatric services in one convenient location. Our goal is to increase the detection and treatment of perinatal mood disorders in the Colorado Springs area.